Hello, this is Dr. Saxena, and I want to introduce myself as doing something called integrative medicine for the last several years now. And particularly when we look at the cases, what we are trying to get these days, there is a kind of I can say this is somehow people are they're not able to decide which way to pursue the therapy when it's coming to stage 4 cancer or particularly any particular cancer, and they just want to know whether we can go for alternative medicine or we work with the integrative medicine here. So we just believe that you need to have something like non-toxic cancer therapies. And when I'm talking about non-toxic cancer therapies, I would like to tell you these are some of the therapies which can be pursued well along with your other therapies also. So I've been working on a thing called hyperbaric oxygen, oxidative therapies, high dose vitamin C, and all that. And for me, I had to all these years I've been trying to learn from some other doctors what how they have come to this particular things. But I can always give you just thing here. If you have been diagnosed with a cancer, it's the most frightening time for you. The decisions about your therapy, which has to be made very quickly after the news is delivered, uh, your physicians or some of may have some forceful opinions on what steps to be taken and all. And apart from the physicians and all, your family and the friends also they'll have present other information to you. So you are left with a kind of you have multiple options. You cannot see there is a information overload here, and I don't think anyone can take immediate all the actions. Trying to work with the diet, trying to work with things and all that. You need someone who can guide you in a proper way, because this is somewhere we believe. um it is like when we started working on this particular thing, people started emphasizing on only and only diet and all, trying to tell them, okay, you need to build this particular stuff and all that. But I can always have one say: you don't bring new furniture when your house is on fire. You have to see that the fire is doused, and after the debris and all is cleared, then only you can always go for the new furniture. So thing is, you have to be very careful how to go ahead with that. You need to first work on some things. What I believe is, when I was handling with most of the for this all these years with some cancer patients, we try to identify someone who is slightly knowledgeable, and among the patients, it can be friends or family people who can. So we try to impart kind of knowledge. We to give them these are the options which I try to do, and yes, you can always look into some of the things, and making a patient's attendant or someone as a possible decision maker and trying to give them all the things what are on the platter. I think that's a good idea, because as a doctor, what I treat, I'm always telling, yeah, this is not the only my prescription is not the only thing. You have to do some more things along with that. Probably a lot of things. We start with mind, body medicine. We start with the positive attitude. We try to work with some detox. We try to work with some. So the patient attendants, they also have to take it. This is PPP. It's a partnership basically. It's not just a doctor writing some prescription telling them everything will be cured. This doesn't happen, unfortunately, in when you are having a daunting task of cancer, something like that. So, I can always tell you, there are some things which have been told to you. Some cancer will be cured by orthotics treatment. Yes, there are some cancers which has early stage of colon cancer. You have got cervical allergy case and all that. Some Hodgkin's lymphomas. There are some seminomas and all that. That can be cured totally. But most of the other things, the results are not as good with what you get there. So the normally cancer treatment is usually classified as curative, adjuvant, or palliative. Uh, Adjuvant therapy is given in addition to potentially curative treatments as surgery. Curative is very few cancers when you quote on the early stage, they are just curative. Yes, you have got to work in the palliative thing also. When we have a pain with the cancer, pain is not going, we need to work with the palliative thing. So, what exactly I just want to tell you about this particular thing is something like what is being told to you. Yeah, this is interpreted. Normally, they tell you the response of this treatment is amazing. They show the decrease in the size of the tumor after the this one treatment, and a complete disappearance is slightly a misnomer. It doesn't happen, and even the partial response is taken as a positive. This one, but we do. Thing is, see, remission always doesn't mean you have improved survival. Patients have done a lot of things, and we have seen very number of cases where the kind of outcomes what we have seen is not which was desired by the what was desired by the physicians or by the patients. Because in certain cases, I can always tell you there is a good role. If like I can tell you example of a pancreatic cancer and the role of a drug gemcitabine. And I'm not qualified. I don't want to discourage people, but this gemcitabine offers an improvement in survival for only few weeks. To some physicians, this is still highly significant, and they strongly encourage the patients to proceed with that. Some patients look at the data of gemcitabine with pancreatic cancer and decide against it and look for other options. Some go ahead with the gemcitabine. Possibly they're hoping that they will get that miraculous cure. Uh, Hoping extra time during which that this gemcitabine works will be make a kind of thing. But you need to work with the statistics. You need to work out what is that particular thing you are achieving after that. I don't want to discourage you that particular stuff, but what I believe is if you can do your own research, uh, that if there is a curative treatment exists for your disease, then go ahead. If only treatments are palliative, then you may wish to consider integrative or alternative therapies, which we try to work it out. Uh, there are some integrative treatments which are used along with the orthodox therapies. It can be surgery or it can be chemo and radiation. We do most of cases of hyperbaric oxygen, which is also a kind of integrative therapy, usually post radiation. So in fact, we do get referrals for that particular stuff. So, but again, alternative. See, when we are having a choice, if you are told you need only palliative therapy, I think you should always look into what is this alternative medicine, with this integrative medicine. So this is what I would appreciate. I would like to tell you to to evaluate alternative therapy. Begin by finding out what is recommended. If a particular treatment involves something you simply will not do, look elsewhere. For example, uh, I try to work out something like a simple process called coffee enema for some patients. And if you are not ready for that particular thing, I somewhere I feel that you should not be thing as it. But I do have patients where a simple coffee enema, where a simple detoxification, a very simple hyperthermia procedure, and it has produced so good results. I don't claim we had a remission or something, like that, but the quality of the life the patient is having. And one more thing I would like to tell you is about the enzyme-based programs combines with high dose vitamin C. Um this, in their opinion, the combining process therapies, they make it possible in if I combine these two things, I don't know which has worked for the patient, but I'm very sure the patient is showing the results. So for me, these are the combination. This is a 360 degrees approach we try to work it out. We are working on the hypothermia, we are trying to work with the hyperbaric oxygen, we are trying to work with the intravenous vitamin C protocol, we are working with some enzyme things and all. So for me, a patient who is absolutely told nothing is possible for that, he's being on palliative therapy, and the tumor starts shrinking, nothing better than that particular thing. I would definitely advise you to look into some of the testimonials what we have, because somewhere most of the doctors are, once you see someone who has done this particular thing, you'll be more motivated to go through the particular stuff. I We have a lot of studies, and we in fact of the we tried working on some of the studies, and yes, we have multiple data now, which are we are trying to publish our case reports now, and probably I can always help you in forming a good protocol for your therapy, and this is the way we try to work it out. And yes, cancer should not be a kind of this one jinx puzzle, and I can always tell you things can be worked in a proper way, and this is not taking much time. I just like to thank you for visiting our website and trying to find out what is best process which can be available. Thank you.